Hello, everybody. Today, we're here to talk about a really interesting topic, but we want to have a little fun with it, so we decided to call it Happy Bladder, Happy Life. And I'm here with the University of Alberta Chair of Healthy Aging, Dr. Adrian Wagg, who, among other things, besides being an expert in many things, including jokes and very good, dry, witty humor, which we may get in some of this, he's actually a world-renowned expert in bladder health. And one of the conversations we really wanted to have was to start to think a little bit, Adrian, about the correlation between bladder health and quality of life. It's probably not apparent to most, but why is bladder health so important for people when it comes to their quality of life, particularly as they age?
When your bladder goes wrong, if you like, for whatever reason, it impairs your quality of life. If you think about, say, people who have accidental leakage, and that's not uncommon in later life. So up to 1 in 4 women, up to 1 in 12 men, they start doing things differently to accommodate to that. And in a way, the bladder symptoms start to dominate their life and can really dictate what they do or what they don't do. Many people will not only start to wear containment products or pads, which they find inconvenient and then have to store or take around with them, but then don't go out as much, become more socially isolated, stop exercising, stop getting as much activity, and there's a pretty significant relationship between depressive symptoms and people who have bladder symptoms. So it just demonstrates the impact it has. And for those people that work, they have more days off, less productive, and have more work-related stress. So yeah, it has an impact.
And so how do we think a little bit about the aspects that impact bladder health?
Essentially, bladder symptoms are more common as you get older. And they may, the culmination is accidental urinary loss, so urinary incontinence. But there are lots of other symptoms that occur in association with aging, partially which seem to be a result of changes in the physiology of how the bladder and the kidneys work producing urine and how you respond to it, but also changes in the brain, which dictate how you respond to the signals your bladder gives you. So by the time you're 70, say, you'll be getting up once at night to pee. Now, for some people, it's 2, 3, 4, 5 times. There are reasons for that. There might be for men, the fact that the prostate's causing some obstruction to the outflow. For some people who are having premature signals of the need to pee at night, and other people who bizarrely produce greater quantities of less concentrated urine at night, which just overwhelms their bladder capacity. Now, all those things are treatable and often curable.
It may seem like a trivial question, but tell me the difference between, or maybe there isn't any, between incontinence and bladder health. Like, what are the correlations and what does the word incontinence really mean?
So incontinence is simply accidental loss of urine.
Okay.
That's it. And it says nothing about how often, how much, when, how long. Well, that's fine. That can be dealt with. So other bladder symptoms are excessive urinary frequency. That's when someone feels they're just going to the toilet too many times a day. It seems abnormal. Getting up lots at night, so nocturia. And then there are other symptoms. We medically split them up into symptoms associated with the storage of urine and then symptoms associated with peeing. So typical storage symptoms are those frequency, this idea of urgency, a sudden desire to pee that you really have trouble holding on because you fear you might wet yourself. Getting up at night, and then incontinence if you cough, laugh, or sneeze, so exertional or stress incontinence. And then the voiding symptoms, hesitancy. At the lavatory, think pee, nothing happens, there's a big delay, then you go. Very common, but can indicate some kind of obstruction. The need to push or strain, having a very poor stream. You're standing in front of the lavatory as a guy and wetting your slippers, typical weak stream, but affects women as well. And that's a bladder problem, not just a prostate problem. And then the feeling of not emptying your bladder properly and dribbling either in the lavatory or when you've left it. So there's the kind of symptoms that commonly affect people.
But when do you know that your bladder health is fine, normal, or that it's abnormal? And what types of things should people watch out for?
So I guess it's easier to describe what is normal. So usually, continence is a learned thing, and part of successful toileting is recognizing the need to pee, being able to hold on to a socially convenient time and passing urine in an appropriate place. That's all part of social continence. a normal pee is 3 to 450 mils, so a Coke can full and a bit. So you should go with a normal fluid intake in a temperate climate, 1.5 to 2 litres. You go about 6 times a day. So it's reasonably easy to say, well, that's a normal bladder habits. Then you get those symptoms, and often those symptoms come on in later life, particularly in women postmenopausally and in older men, often but not always due to enlargement of the prostate in association with aging. But obesity, diabetes, poor diet, poor levels of physical activity all predispose people to abnormal bladder health.
When is it that they should say, okay, I should go and get help? And what type of help should people be getting?
So there's two problems. There's a lack of awareness about what can be done in the general population. There's often a normalization. So people will either delay seeking help or not seek help because they think it's normal for getting older. Up to 1 in 4 women over 65, for instance, will think, yeah, it's normal to wet myself because I'm getting older. There are very simple things to do. If you feel that your bladder symptoms are affecting your life and causing bother, that's really a very personal opinion. But if you have bothersome lower urinary tract symptoms, that's when to seek help. And there's lots of resources on the internet from, say, the Canadian Continence Foundation or the urological associations or the obstetrics and gynecological associations aimed at patients with a problem. And self-management can probably deal with the majority of symptoms and manage those without seeking help. But of course, there are professionals out there who can offer help and reinforcement of the right thing to do depending on the nature of the problem. For those people that have exertional incontinence and even urgent, what we call urgency incontinence, will go straight to pads without even thinking about what can be done by yourself before you seek advice.
Yeah, so let's talk a little bit about that. What types of things can people do?
The first thing is a combination of pelvic floor muscle exercises, which women do pre-childbirth to maximize their pelvic floor strength, and men do for after prostate operations. That's the first line treatment for any kind of incontinence. They can be done with supervision of a pelvic floor physiotherapist, but it can be done on your own. The results aren't quite as good because a personal trainer gets better results, but it's a very acceptable first line management for any kind of incontinence.
So when is it more than incontinence? Like when are there signs that it's more than just a bladder or urinary problem?
Clearly, accidental bowel leakage, as it's called in the public domain, are, again, up to 10% of people in late life will have fecal incontinence, but only about 2% say that it's a problem and seek help. So you think about stigmatizing illnesses, urinary incontinence and fecal incontinence are great examples of that.
When should one be worried it's more than just incontinence? That there's like, what are the signs that someone should be very worried? I mean, I would assume the first one is like if there's blood in any sort of urine, otherwise you're
Yeah, so
worried.
so there are the things we call red flag symptoms. There's something else going on. And that would be, as you say, blood in the urine, and there's a huge campaign, there's the public awareness of blood in the urine, and that can be an indicator of your bladder tumours or infection or bladder stones and pain during peeing. And those are the two simple red flags that everybody should be aware of and go to the seek healthcare advice early if that happens.
One of the areas that some people get very bothered by is having to get up lots at night to go to the bathroom. Are there things that you think they can do to help themselves or to get better at that?
Yes, I think there are a couple of very simple things you can do. Certainly, not to drink anything after 6 o'clock in the evening. That would clearly limit the amount of urine produced at night. The second thing is actually to limit salt in your diet. If you typically add salt to your food, then reduce that or stop, and that will also have an impact on the amount of urine at night. The other thing, again, is to make sure you're not going too frequently in the day and inducing a small capacity, high frequency bladder. So you can actually drink more when you're at home and hold on like Billy-O to stretch your bladder up, and that can reduce frequency too.
Awesome. Well, thank you. This has been really helpful, learning a little bit about happy bladders and happy lives, because obviously, there are these small parts of life that limit you from having the best quality of life. And Sometimes people don't always talk about them, but they're really important to just make sure you get right. And it'll probably be very helpful for them in the future.
Thank you.
Thank you so much for watching this episode of OLTV. If you liked what you saw and you want to watch more, like this video and subscribe to the Optima Living channel right here on YouTube.